This portion of CardioSource video news coverage of AHA 2010 is brought to you by Novartis Pharmaceuticals Incorporated.
Well, I'm here at the AHA with Keith Aaronson of the University of Michigan, who's presented here fascinating new data of a new continuous flow ventricular assist device. And so we'll hear the latest on a novel device that's in the process of undergoing FDA approval trials. Can you just tell us what this device is in terms of how it differs from previous ones?
Sure, Chris. The HVAD is a very small continuous flow centrifugal design pump. The pump displaces about 50 milliliters and is only about 5 ounces. So a very small pump. It's placed in the left ventricle with the motor and the entire pump housed within the pericardial space. So there's no abdominal pump pocket, which is a real innovation. The pump, like all ventricular assist devices, pumps blood into the aorta, in this case into the ascending aorta. There's a drive line that exits the abdomen connected to a microprocessor and batteries.
Right. Well, and then you've done a study, I guess, with a control group to try and see how this compares to currently available devices.
Yes. So we looked at 137 patients who received the HVAD, and then during the exact same period, we looked at 497 patients who were enrolled in INTERMAX, which is a national agency. A national registry funded by the NHLBI and sponsored by FDA and CMS, housed at the University of Alabama, Birmingham. And this is a registry of commercially available pumps. So we compared the outcomes with the new pump to the commercially available pumps during the same period.
Great. And so with procedural and then clinical outcome success, how did this pump fare?
Things went very well. So success for this trial was defined as living 180 days on the originally implanted device, or receiving a transplant, or being explanted for recovery. There were no explants for recovery in either group, but success based on the other two parameters was 92% for the HVAD and 90.1% for the control group. So really, one of the big messages here is that regardless of pump, we do very well now with ventricular assist device therapy in the United States.
Oh, that's terrific. And how about other factors? Bleeding is often a feared complication with these, or other procedural issues?
So adverse events were looked at only in the HVAD group, because the other was a control group from a registry. But adverse event profile looks to be favorable. So bleeding, as you note, has been a real problem with the axial flow pumps. And bleeding was low. Bleeding was much lower than has been reported with previous publications with the axial flow pumps. And infection was also substantially lower than had been previously reported. I'm not sure why. We know that there's an acquired von Willebrand syndrome that's been seen with axial flow pumps. Perhaps that's different. We don't know. We need to investigate that. There's also the issue of decreased pulse pressure, and there's less pulsatility with these pumps than normal, or with the previous pulsatile pumps. And there may be differences between centrifugal flow, which is the way this device works, and axial flow, but that remains to be seen.
Terrific. Well, very exciting, and we'll look forward to seeing this progressing. So from the AHA, I'm Chris Cannon with CardioSource Video News. Thanks, Chris.
Special thanks to Novartis Pharmaceuticals Incorporated for supporting continuing coverage of CardioSource Video News at AHA 2010.